Elastic arteries contain, they're large diameter, they receive blood under high pressures, right? And they contain more elastic tissue than smooth muscle. Now compared to a regular artery, now compared to a vein, it always has more smooth muscle. All right, so just keep that in mind. Here we're comparing it to other arteries that we're going to talk about later. Right? Relatively more elastic tissue than smooth muscle. Very thick tunica media and thin tunica intima. Now, important thing about this is the next slide. Right? There's two main ones. I would say three main ones. I'll give you two examples. Best example is the one right here, aorta. Right? The aorta, the brachiocephalic trunk, the celiac trunk, right, are all example of elastic arteries. Now, the aorta is the best one, right? What happens? When blood goes from the ventricles into the aorta, you stretch the aorta. It's got a lot of elastic tissue, and what happens then is that it can function as a pressure reservoir. What does that mean? Right? That means that when the left ventricle relaxes, the stretch of the aorta allows it to then contract, to then snap back to its original shape. As it snaps back to its original shape, it can eject blood forward and backward, right? So some blood actually goes forward as a result of the aorta snapping back to its original shape from the stretch. Some of the blood that hasn't made that turn yet, that blood goes backward. And that blood, as it goes backward, hits the cusp of the aortic valve and closes it up. Right? That resistance, that stretch and then sudden, right, snapping back is what causes that blood to come back and close the aortic valve. Perfect. Now you have that blood sitting on top of the valve. Hopefully it's very little bit. All right, so then our afterload isn't so high. But that's what we mean by pressure reservoir. Right? Now next one, muscular artery. Muscular artery, there's a lot of them, and they're named after the organ they go to. Hepatic artery, gastric artery, renal artery, superior inferior mesenteric artery, which we haven't talked about any of these yet, have we? All right, well, we will this right tonight. These arteries contain a lot more smooth muscle, and they allow vessels to regulate blood supply by constricting or dilating those regions. So when we are working out, right, we want more blood flow to the legs. What happens? The celiac trunk, right, the superior and inferior mesenteric arteries that goes to our GI tract, the renal arteries, they all slightly vasoconstrict. As they slightly vasoconstrict, there's less blood flow going to those organs, right? The organs and the blood vessel that goes to your leg muscles, they dilate, right? As they dilate, now we can bring more blood to those skeletal muscles. They're also called distributing arteries because smooth muscle allows vessels to partially regulate blood supply to different regions of the body, so they can distribute blood to the active areas of the body. Again, muscular arteries usually named after the organ it goes to. Right? Another one that we mentioned probably is the radial artery, things like that. Right? Ulnar artery, those are muscular arteries as well. And then eventually, the muscular arteries lead to even smaller arteries when they enter the actual organ. Right? So when they enter the organ, like the renal artery, well, it goes into smaller arteries, and then eventually those smaller arteries lead to many more arterioles. Arterioles transport blood from small muscular arteries to the capillaries. And this is where it's important right here, right? This is highlighted and underlined, so you might see it a couple times in the test. Right? You will see it on the test just how many times, right? I say that and people still don't, right, know it for the test, and it hurts my heart when people don't know it for the test, right? Why? Is because this, arterioles, because there's so many of them, right? Think about it. If you have the aorta, number one, it's so big, you can only constrict it so much, and there's only one aorta. That's it, right? But with arterioles, there's many of them, right? Because there's so many, when they're slightly constricted, you have to multiply it by how many arterioles we have in the bloodstream, right, in the cardiovascular system. Because of that, this is the main player in defining your blood pressure, right? Again, 99% of hypertension, high blood pressure, is idiopathic. We don't know what the cause is. All we do is then treat the symptom, right, by vasodilating the blood vessels. But all of the blood vessels we vasodilate. You've heard of calcium channel blockers, right? You've heard of angiotensin receptor blockers, right? Beta blockers, right? All of those work on the arterioles, causing the arterioles in your body to relax and dilate slightly. As each arteriole has a slight dilation, then you have a lowering of your blood pressure as a response to it. Right? Now, later on we'll talk about, I know you're probably going to ask me why I'm mentioning this now, so I'll just go and say it. Later on we'll talk about Viagra, right? And Viagra, right, is going to also lower your blood pressure by lowering the arteriole. The problem was it sucked as an antihypertensive because it did not vasodilate anywhere else except down there, right? But the problem was they could not get the medication back, right? So you're treating people, and Pfizer, right? They were receiving, people like, oh, we take the blood pressure. There's no, drop in blood pressure compared to other meds. So they thought it was a dud. They thought he just spent $1 billion and it all went to nothing. And the problem was they could not get the medicine back, right? You can imagine if your drug failed the clinical trials, the last thing you want is that medication to be accidentally used and somebody dies from it. So they have to get the medication back. And nobody would answer their calls, right? Eventually they talked to the wives of the patients, and they found out that there's one place that actually vasodilated. But that's why they always have that warning. Do not take this if you notice an unsafe drop in blood pressure, right? Because if you're taking your normal antihypertensive and you're taking Viagra, which should have been an antihypertensive, they can kind of collide, and in some people, it can drastically lower the blood pressure, right? So, yeah, we'll talk more about that later. It's kind of funny, right? All right. Venules and small veins, again, it's one big unit, right? One big closed system. So the arterioles will lead to capillaries. Arterioles play the key role in regulating blood pressure, right? And then they lead to the capillaries, and the capillaries will lead to the venules. The venules then will lead to the veins. Right. Now with medium and large veins, right, with all of this, keep in mind, right? In terms of veins, we're gonna see that they have a tunica media, but it's got very small amount of smooth muscle, so you can't really regulate and vasoconstrict or dilate or pressurize. And it's got a lot of elastic fiber, so then there's a lot of stretch that's possible. So if we don't have a lot of smooth muscle, how do we get blood from the lower body back to the heart then? Right? How do we increase venous return? Well, what we're gonna see with veins is that veins have valves, right? And those valves, they act very similar to other valves, right? Our body follows natural laws. Those valves prevent accident. And you're wondering, wait, how does that help, right? Well, valves found in medium to large vein, they're folds, all right? There are folds in the intima forming two flaps that overlap. You have more valves in the veins of the lower extremities. Why? Because it's below the heart and because of gravity also pulling down, right, making it harder for blood to go back. Now, I'm just going to show it to you now, right? It's going to be a little bit further here. I'm going to come back to it again next week. I just want to show you what we mean by it. Right here. Right, slide 49. How does a vein work then? How does the activation of those valves work? Right? Well, instead of having a strong heart to pump blood out, right, we have a couple of different, not real pumps though, right? Pseudo pumps. The skeletal muscle pump and the respiratory pump. And this should make sense, right? What happens? right? What happens is this. Deep veins of the legs, we're going to talk about probably next week, the anterior tibial, posterior tibial veins, the fibular vein, right? The femoral vein. These deeper leg veins are very important because they're right next to your skeletal muscles. And what happens? As we're walking, right, the skeletal muscles contract. As the skeletal muscles contract, the skeletal muscles then start to push the blood from the veins upwards, right? Again, those deep veins are close to the muscles. So as the muscles contract, it causes blood to go up in the vein. As the blood goes up in the vein, right, then when you relax, the blood wants to come back down. But that's where the valves come in. So as the blood goes up, as you relax the muscle, all right, blood comes back down a little bit, but then it engorges a valve. The valve closes. And now I have moved up one segment. Then when I contract the muscle again, the muscle contracts, causing the blood to move up a little bit again. When it relaxes, it activates a valve from the next segment. Now I've moved blood up the next segment. So the more you contract the muscle, that cycle of relaxation and contraction and relaxation, right? The more you contract and relax, the more you move blood up from one segment, then to the next segment, then to the next segment, right? This is the reason why they want you to move and walk right after you recover from your surgery, right? So as soon as you can kind of, you're kind of with us, right? You've gotten any kind of surgery. It can be actually even open heart surgery. As soon as you're able to get up, they want you to go up and walk around. Why? It's because you're activating that skeletal muscle pump. As you're activating the skeletal muscle pump with each contraction, you move up the blood up a couple segments. With each relaxation, you activate the valve, but who cares? You've already moved up a segment or two, right? And you have that continued cycle of contraction, relaxation that will then move blood all the way to your inferior vena cava. Perfect. We're halfway there. Then comes our respiratory pump. The respiratory pump decreases the thoracic pressure and increases abdominal pressure doing inhalation. In the process, you move blood from the veins into the right atrium. So into the inferior vena cava, directly into the right atrium. Into the thoracic veins, into the right atrium by the azygos, right? What is this? You guys kind of understand the skeletal muscle pump? That means that the more you contract the muscle, the more you go up segment to segment. Once you get to the inferior vena cava though, right, we need another pump to bring it up. That's the respiratory pump. And the respiratory pump is going to be very dependent on a law that some of you might know and have heard about, right? And that law, if you've had chemistry or physics, you might have heard of this law. That law is called